Hi, my name is Kimberly Shoup, and I'm a diagnostic medical sonographer. I hold registries in abdomen, OBGYN, and vascular, and I've been performing ultrasounds for the last 16 years all across the country. And I've been in about 23 different facilities, and I've worked with over 20 different types of ultrasound equipment. Originally, I was a teacher, so I have about 30 years of teaching experience combined with my ultrasound experience. I was originally an education major and minored in psychology. And today I just want to do a brief teaching about ultrasound knobology. Knobology is basically a term that just states the proper use of the ultrasound buttons and knobs in order to produce diagnostic imaging. So basically, in a nutshell, knobology is just knowing how to work the buttons in order to produce nice images. The first button that we want to know is the freeze, cine, or store button. If you press the freeze button, it's going to freeze the image on your screen, and that's automatically going to save the image to the hard drive on the machine. You can also press the cine button, which actually takes a little movie or a little video clip for the radiologist to see. A lot of times they want to see the motion of a fetal heart. So you would go ahead and hit that button, and that would save the image to the ultrasound machine. The next button that's important is the gain button. Gain has to do with the brightness of the image on the screen. I have pictures here. This actually shows the TGCs. Ultrasound techs love to run their fingers along the TGC buttons. That helps improve the quality of the image. You can make it darker in one spot or brighter in another just by moving those TGCs. In this case, you can almost see the brightness of the liver here, and it gets a little lighter as you decrease the gain. So gain is very important in producing high quality images. The next button that we're coming to is the focus or the focal zone button. You always want to draw the radiologist's attention to the area of interest. And you can do that by toggling your focal zone or your focus arrow right to the area of interest. In this particular image here, we have a gallbladder with a gallstone, and we've placed not just one focal area, but two. We've got two focal arrows placed here, and that's our focal zone. So we're drawing the attention to the radiologist to this area and saying, hey, look at this pathology that we have right here. By the gallbladder, we've got a stone right near the neck. So focus and focal zone are very important to draw the radiologist's attention to that area. The fourth button that you definitely want to know how to operate is the depth button. Depth shows you how far you are from the surface of the patient's skin. Obviously 1 centimeter is only 1 centimeter from the surface of the patient's skin, but 16 centimeters is deep inside that patient's tissue. Depth is important for radiologists to know, particularly if they want to drain fluid for a paracentesis. In this picture, this black area is all fluid and surrounded by loops of bell. So the radiologist is going to want to know, hey, where exactly is that fluid located? Well, we know that it's 1 centimeter from the surface of the skin is where it begins, and it's 8 centimeters deep. So as long as he numbs up that first centimeter of skin and sticks his needle within anywhere between 2 and 8 centimeters, he's going to hit that fluid pocket, and that patient's going to have that fluid drained, and they're going to feel a whole lot better and be able to breathe a lot better. Moving on to the fifth button that we want to know is the Doppler button. Doppler has many different functions, and every ultrasound machine has the color Doppler button, the pulse wave Doppler button, the M mode, and also the power Doppler. All of these give the radiologist different information. You can tell waveforms with pulse wave Doppler. It's going to show you the pulsatility of an artery, and it's going to show you the phasic flow of a vein. M mode is going to show the motion of a baby's heart, and you'll be able to track the baby's heart rate to show the radiologist how many beats per minute that fetus's heart rate is actually beating at. Color Doppler is going to give you an indication of the flow direction of the blood. The red indicates that it's flowing toward the transducer in my hand or toward the patient's heart. The blue indicates that the blood is flowing away from my transducer in my hand or away from the patient's heart or toward their feet. Power Doppler is just a stronger color, It helps detect slower blood flow or almost obsolete blood flow. In this particular picture, we have a picture of an ovary, and they were trying to rule out torsion. They couldn't see the blood flow in this ovary, and then they turned on the power Doppler, and there it is. You can see venous and arterial flow in this image. Also, another important feature of the ultrasound is its ability to measure and do calculations. A lot of times radiologists want to know what the diameter of a vessel is. For instance, the abdominal aorta, we don't want it to be dilated or there's an aneurysm, so they're going to want to know by the tech placing calipers on the vessel to see what the diameter of that vessel is. Or if there's a mass, they want to know how big it is, or the volume of an ovary. All of these measurements go into the calc package, which is saved into the report, and the radiologist will have all of that information on the last screen of the ultrasound exam. And you obtain all of those by pressing the measure or the calc button on the machine. Another important feature of the ultrasound machine is the zoom. We have pictures of the common bile duct here. It's very tiny. You can't even see it usually unless you do use the zoom button. Zoom actually just enlarges the image just right where you want to focus the attention. So it just makes it bigger. Zoom is a great way to see a 3 millimeter structure come up bigger, and it helps you place the calipers or the measurements more accurately for those tiny, hard to see structures. The final knob that you want to know where to locate on the ultrasound machine is actually the annotate button. And you are actually going to label your image. You're going to let the radiologist know, hey, I'm scanning the left kidney, and instead of the right kidney. If you don't label it, then they don't know if it's the right or the left, but you're indicating what body part you're actually scanning. In this particular image, they've actually labeled the liver and the portal vein, and inside the gallbladder there's actually a gallstone. They actually placed an arrow indicating here's some pathology for you to look at, and they labeled it gallstone. Annotations are important. Again, it helps the radiologist know exactly where you're wanting them to focus their attention and which body part you're actually imaging. If you master these 8 simple Knobology functions, you'll be able to produce high quality diagnostic images on any piece of ultrasound equipment that you sit down at. In a nutshell, if you know these knobs, you'll be able to do any job that you need to do. That's the conclusion of this presentation, and I thank you for your time.